for somebody who's not familiar with the company, how I would introduce it would be that we are truly pioneering the new development of what's called pro-resolution therapies, which are kind of the next wave of innovation in to treating immune diseases, so autoimmune diseases and acute immune diseases.
This is a terribly destructive arthritis if left untreated. Here's the head of a finger joint and finger knuckle where you can see there's a real hole eaten through the bones where the inflamed tissue is eaten through joints. Now, what drugs do we use? Well, we've had anti-inflammatories or NSAIDs and steroids for many, many years. And we know that they help symptoms short term, but they're not disease modifying and they carry lots of side effects. It's a constant balance for us when we're prescribing drugs, and you can see steroids are a drug, and I've got a particular wish that we reduce the amount of steroid use we're doing. These are associated with a lot of long-term problems, including weight gain, diabetes, hypertension, and osteoporosis.
I think that that Philip here gave a rather nice introduction of what we have been working with in the last year with the development of resomelagon, or AP1189 that we have called it until recently, in rheumatoid arthritis. All the compounds that was mentioned in the speech do have either unspecific or specific inhibitory effects. So it inhibits the immune system, and in many cases induce immunosuppression, which most highlighted here with the JAK inhibitors, with increased risk of inflammation. Our compound do have some anti-inflammatory effect, but it's not so that we induce immune suppression, and that's very, very important from the way it works. And then we compare to all current treatment approaches, we induce what we call resolution, meaning that we are boosting internal, you could say, pathway in the immune system that helps getting the immune system to another set point. So we do not take out the inflammation, but rather bring that to a new set point. And we have one of the cell, and most likely we are working a lot with is macrophages. Macrophages are present in the synovial, which is the tissue next to the joints, and they are already in pre-RA stages. They are pro-inflammatory. We know that we can reduce the activity of those and at the same time get a larger fraction of the cells to be pro-resolving, meaning that instead of secreting cytokines and other mediators, they go into a phenotype where they help clearing up the inflammation. What we really have seen over the last 2 to 3 years is an increasing understanding of our concept of resolution pharmacology.
What we do that's basically, almost any other company doesn't do. We do pro-resolution therapies, and pro-resolution therapies have the promise of being non-suppressive to the immune system. Every other compound that you use very effectively also suppress the immune system, which comes with a lot of side effects. And that limits the use of these drugs very dramatically. So we're trying to do something differently and trying to get out of the box of immune suppression to really limit the number of side effects of becoming very safe to use, so you can use it very early and to treat the disease early.
We have worked with the arboviral infection, as we have highlighted previously, where we work in dengue fever, which is a major problem, not at least in more warmer part of the world, but it will eventually be something that you should have focus on in Europe as well as in US, as the mosquito who is the bearer of the virus is now endemic. Further into other arboviral infection, most importantly chikungunya, which is a disease that is also, you could say, spreading. So, in respiratory infection, we do have this ability to inhibit neutrophil recruitment and activity. We do not suppress them, but we modulate the activity. Here in the alveoli, which is the functional unit in the lungs, that macrophages, pro-inflammatory macrophages, plays a significant role for the initiation of the severe inflammatory state you see in respiratory infections. By stimulating melanocortin receptors on these key cells in the immune system, strongly indicate that we can modulate this response and thereby have, as we saw in the COVID-19 patient, have a benefit for the patient. When the patients come to hospital, an antiviral is probably too late to give that. It's not any longer a question of suppressing the virus, it's a question of modulating the inflammation that has been triggered, this hyperinflammatory state.
Looking at the market right now, there's a lot of cases where patients come to hospital each year. Actually, just in the US, more than 1 million patients get to hospital each year because of influenza, RSV, and COVID-19. The exact same numbers are valid in Europe. It's all about how can we address patients with higher risk and get them either avoiding getting to hospital, that makes sense, but once they get there, how can we get them out of hospital as fast as possible? That is exactly what we're trying to do. If we look at the market, just for the antiviral medicines used in this manner, is projected to grow to more than $5 billion US. I would say this is a highly developing field.
I think that we have had fantastic progress. We have generated a lot of new data and very interesting and promising data in the virus field.
We have a lot of potential partners waiting for data, and I think without promising too much on good data, I'm pretty sure we will be in a position to potentially do a deal. We are going to Bio International in the US, which is the biggest partner event in the world. Well, right now it's a very exciting time for us. We have just finalized the recruitment of patients in our main study and are having a follow-up now of 3 months. That means that we will have data in June. The full focus on strategy is to do business development on these 3 projects. Thanks to a lot of you investors, we are also in a nice position financially, and it's simply coming out of strengths. We want to be well equipped for doing business development. You can be sure that the partners that we are in discussions with, they will know exactly where we are.
What we're looking for is then is back to some of the geographies. It would obviously be amazing to have a global view on one, but there's also good reason to say, okay, maybe there are certain regions that we should look for. So the US obviously being very important, but a Chinese area, Japanese and so forth could also be very, very interesting from companies who wants to be part of the innovation and wants to take kind of that leap into a market, a very interesting market like RA.
We are a company that have worked for quite some time leading up to data now, and over the next 2 quarters we are getting basically all the data. So it's a big transmission for us, coming from a waiting position into a pretty forward going towards business development.